For more on this, tumors drastically shrunk. This has to be great news.
It is, George, and we have to remember that there is always reason for optimism, especially when you're talking about the world of oncology and cancer. But the awareness is key because, as Will said, this only represents about 4% of all cancers in the U.S. So people do need to be kind of aware of what the symptoms are. They're vague, but they can include enlarged lymph nodes, generally in the neck or armpit or groin, fevers, night sweats, unintentional weight loss. Of course, you can have many of these things and not have lymphoma, but when a celebrity like Jeff Bridges comes forward like this, it does so much to increase awareness.
Yeah, we don't know exactly what kind of lymphoma he has, but what are the treatments out there?
Well, again, it depends on what type of lymphoma. It depends on the age of the patient, the stage of the lymphoma. But in general, you're talking about chemotherapy, radiation, some targeted therapies. But these can all be incredibly effective. And again, we follow it a number of ways, sometimes with blood tests, but really the classic is with imaging studies like CAT scans. So when we see tumors getting smaller, that's what we want to see.
Exactly what we want to see. We're so happy for him. Jen, thanks very much.
Need to know.
Yeah.
Where's that?
This is the party.
Oh.
Welcome to your party, TJ.
Yeah, y'all party planning. It got my attention.
Just right here, small.
I didn't sleep enough. I've been down. I heard party, and I just perked up. Hey, all right. Well, welcome to the party, people. Good afternoon. Thanks for being with us on GMA3, What You Need to Know. It is Friday. We made it to Friday. Yes. And another week of what was that we just saw?
I don't even know.
Yeah, we call it history, though. It was historic.
It certainly was. And by the way, even if you're a little tired, you certainly look dapper today.
You know,
we're liking the look.
Yes. Thank you. Thank you for that.
Yeah. See, I have some kindness in my heart for you.
5 months of this show. First compliment. Rose, thank you.
You're welcome. Happy Friday. And the ever always stylish ABC correspondent, Dr. John Ashton, here with us as we're tracking all of the day's major developments, and there are quite a few to get to. So let's take a look at the latest numbers from Johns Hopkins University. More than 93.2 million confirmed global cases of COVID-19. The U.S. unfortunately still leading in diagnoses with at least 23.3 million as we now mourn at least 388,000 American lives.
All right, Doc, we've been talking about this vaccine rollout.
Yep.
Obviously slower than it needed to be. So demand, access, can I get it? Where is it? All right, where are we?
All of that, the themes of the year, and it's certainly the first month of the rollout. So let's do vaccine by the numbers and take a look at some of these critical numbers at this time. Remember, this vaccination campaign started on December 14th. At this point, there are at least 11.3 million doses given, that's administered in people's arms. At least 1.08 million people have completed the 2-dose regimen, so that's good news, but that's not a big number. 3.4 doses have been administered for every 100 people here in the U.S. For comparison, look at what Israel has been able to do. Obviously a much smaller country, but 23.9 doses administered for every 100 Israelis. So they are crushing this campaign for sure. Overall, here in the U.S., just 37% of the supply that's been distributed has been actually given to people. We need to step on the gas here.
And you know, I'm hearing, my parents just told me they meet the criteria, but they can't get an appointment. My 97-year-old grandfather, they can't get him an appointment. So what's your advice to people who want the vaccine and don't know how to get it?
And obviously this is the name of the game really all over the country because this is in state and local control right now. So what I've been recommending to my patients, now this is not an official national recommendation, this is real life, real practical advice, is you're going to have to spend some time on almost a daily basis, if necessary. Check your state Department of Health. Check those national pharmacy chains like CVS, Walgreens, Rite Aid, and then be prepared to pivot last minute, because what's happening is people are signing up for vaccine 3 o'clock in the afternoon. Those vaccines have been removed from the freezer. People don't show up, and you can call and say, listen, do you have any that people didn't show up for? I can be there in 5 minutes, and be prepared to pivot, and you may get lucky.
It's really good advice.
Right.
You're right. They have to use it once they pull it out.
Yeah.
They have to use it.
It's come to that, at least right now.
All right. Thank you so much, Dr.
Dr. Ashton here with us now. Can't believe you were about to say what you're about to say.
Yes, and unfortunately not for the first time in this pandemic, but COVID-19 is now the #1 leading cause of death in the United States, surpassing cardiovascular disease, heart disease, and cancer. Just to give you an idea, numbers and how they stack out. We normally see about 2,300 Americans die every day due to heart disease. That is the #1 killer of men and women. We normally see about 2,000 Americans die every day of cancer. In the last week, you guys, we have been averaging over 3,200 deaths a day due to COVID-19. So it's really important to keep those numbers into context, because as we've talked about here before several times, we still have to worry about cancer. We still have to worry about heart disease. Medicine, public health is not a singular, we only look at one thing at a time. But when people say, oh, your risk of surviving is so high, this isn't important, #1 cause of death is a big deal.
Doctor, are we seeing that? Are we right in the middle of that surge, that post-holiday, or is it still got another week or two or three?
Everyone's asking that question, and it's important when you look at epidemiology. You don't really know where you are. We've talked about this with influenza until it's behind you. So it's a retrospective kind of diagnosis, if you will. We are still going up and up and up, and we're in the middle of winter, so a lot of people are inside, and pandemic fatigue.
And I think a lot of people are thinking, well, the vaccine's just around the corner, and so they may let their guard down.
We're in a very, very, very tough situation right now.
Around the corner. The vaccine is here and sitting in some places.
In freezers.
In freezers. All right. Dr. Ashton, thank you as always. All right, folks, stick with us here on GMA3. We are right back in just a moment. An extraordinary scene, a number of extraordinary scenes for good, bad, and ugly. But that's a nice one. That's a
Certainly
nice one.
was.
Yeah.
Thank you. All right. We got Dr. John Ashton here now with answers to the questions that you've been asking. So the first question, if all members of our family get vaccinated and wait 15 to 20 days after the second dose, are we then able to get together without masks and social distancing?
Not so fast. Okay, now listen. Vaccines obviously critically important in preventing severe disease and therefore saving lives. Okay. However, and here's the big but, as they say. First of all, 95% effective does not mean 100%, okay? 5% is a real number, so you might be in that group. Remember, this 95%, 94% efficacy refers to the vaccine's ability to reduce the rate of severe disease. It doesn't necessarily mean it prevents infection. You can be infected and asymptomatic. And then remember that, you can still be exposed. You can still get someone in your bubble that could potentially get sick. So can you loosen up a little? Can you eventually get back to that? Yes, but not so fast.
When?
If you listen to Dr. Anthony Fauci, when about 80% of the United States is vaccinated. And that is also, we're keeping an eye on these new variants as well. So it's just not that simple.
All right, next question. Is cardio or strength training better for weight loss?
I love this question, and we actually did a deep dive into this nutritional science research when I was getting my degree in nutrition. The answer is surprising, because we know cardio is good, but you can't rely only on cardio for weight loss. Studies have shown that the people who lose the most weight and keep it off are those who actually do a combination of weights, resistance training, which is so important, especially for women, and cardio. And that cardio for weight loss really should be, as I say, low and slow. Long duration, 60 minutes if possible, but not at your maximum rate of exertion, because the lower heart rate zones are actually the fat burning zones.
Right, and don't muscles burn fat as well? So the more muscle...
Right, and the harder you exert yourself, you're actually getting your energy from muscle breakdown, not fat.
Got it. All right. Thank you so much, Dr. Jen. And you can submit questions to Dr. Jen on her Instagram at Dr. J. Ashton.
We wait for this segment all week now. It's Faith Friday here, folks. Second season this Sunday coming up. Now, that's how we were. We saw ourselves at a bus stop. We had a picture of us. Robach and I did the same thing. That's us.
That was her vision board.
Yeah, she manifested it. Right?
All right, you guys, final thoughts today inspired for Food Friday. We know that food can nourish our soul. We know that food can be our medicine. And we talked at the beginning of January about the flexitarian diet. Have you guys heard of the climatarian diet?
What is this?
No.
All right, TJ, you're going to love it.
Okay.
Open-minded.
All right.
Okay.
Yes.
It's really an easy way to eat more plant-based foods that are not only potentially a little healthier for you, but healthier for the climate, for the environment. A Yale study found that 54% of people would be open to eating more plant-based foods. So You can test the waters, just dip a toe in 1 day a week. Why not this weekend? No time like the present. You want to look for some more plant-based, some low-calorie foods, lower-calorie foods, some foods that have been more humanely raised in terms of the environment and that have a lower environmental footprint. Climatarian, TJ.
My issue is not the diet, it's the names they give some of them sometimes.
Okay.
Flexitarian, climatarian.
Ashton diet works too.
That works. All right, Dr. Ashton, thank you so much. That's what you need to know for this week on this Friday. Everybody, join the conversation on Twitter, Facebook, and Instagram. Everybody, have yourself a great weekend.
That's right. And I'm Amy Robach. We're going to see you right back here again on Monday for Dr. Jen Ashton and all of us here at ABC News. Please stay well, stay safe, and enjoy your weekend.
Some days you wake up and nothing